This is Global Health, Unit 15, Part 3. So let's continue our discussion, and we're going to now talk about Qatar. So when you think of Qatar, or you think of Saudi Arabia, or you think of Dubai, or you think of United Arab Emirates, Yemen, Oman, what is the first thing that comes to your mind? Right. Camels and desert. At least when you think of Saudi Arabia, that definitely was true. But I have grown over the last 9 years, I've grown to really appreciate the beauty of the desert, and that's a good thing. So here we are in Qatar, the Middle East, and this particular country is on the Saudi Arabian boot here, this shape of a peninsula. It's just south of Turkey and forms this one side with the Red Sea. This is the Arabian Gulf, and of course this is the Indian Ocean right here. So you have Iraq, Iran, Saudi Arabia, Yemen. This big country here is Oman, and this is where I live in United Arab Emirates. And you can see this is the Straits of Hormuz that they always talk about in the news, because of course here's Iran and here's UAE, or right next to Dubai, and this is where the ships come in and out. So this is a very important strategic location. And then of course the US ally here in Qatar. Qatar has both an army and a US Air Force base in the country. So they used Qatar as a refueling station. They have bases here to launch attacks on Iraq during the Iraq War years ago. In addition, here's little teeny Kuwait. So this is why this one's very strategically located right next to huge Iran and Iraq, sort of breathing down the neck of poor little Kuwait. But Kuwait used to be the richest country in the world, but its oil production was damaged by two complete takeovers and attacks by Iraq. So they have been subdued in their production of oil and gas, and Qatar now is the world's richest country. The capital city is Doha. And in contrast to Saudi Arabia, this is what you kind of think. Actually, King Abdullah of Saudi Arabia has just died, and his successor is one of his sons. So it is King Salman now in Saudi Arabia. But of course, Saudi Arabia and all of the Middle East are famous for their date palms, the beautiful deserts they have here. They have a history of huge fortresses. You see this type of fortress? It seems like it might be just like Egypt or even Spain. And they're famous for their Arabian horses and horse races, beautiful horses. You have to remember, in the Olympics just last year, the Saudi Arabian women's sport team participated. It's the very first time that they have participated in an international sporting event for women, because they originally were not going to be allowed to wear their head coverings, which is a traditional part of the clothing for women in the Middle East. The Olympic Committee conceded that they could safely wear them, and so they did participate. So that's pretty cool. Things are always changing. So here's another map just to remind you of where Iran, Iraq, Syria, Jordan, Saudi Arabia in proximity to Qatar. The population here is about 2 million, and it is only 11,000 square kilometers. The primary language is Arabic. However, most people that I work with, all the business people, they speak perfect English. After all, these Qataris are the richest people in the world. They own a lot of properties in Europe. Many of the big businesses and properties in all of England belong to Saudi Arabia and Qatar and UAE. I know I met one of the sheikhs in Qatar, and he was asking about California and the fires there. He owns most of Southern California because these people are so rich, they have an opportunity to buy a lot of things. In Qatar, again, the religion is Muslim, and about 90% of the people are Sunni Muslim, which is a very moderate sect of Islam, and the Shia Muslim is only about 14%. Per capita income is over $90,000 a year per person. And again, we have about the same number of physicians as in Egypt. However, they have twice as many nurses. So you see the per 10,000 population. And these physicians are very often foreign trained in Europe or the United States. So the quality of physicians in Qatar is better than in Egypt. And look at our life expectancy, 82. So again, it's in par with Spain or other places in Europe. It's quite long in contrast to Egypt. Qatar in 2010, it has a population about 200 million. So again, we were talking about this, to summarize, about most of the people, 1.5 million of them all live in Doha. And the city has grown so much in the last 10 years that I've seen. It's remarkable. Poverty tends to be undocumented. They've got 94% literacy among men, 87% among women. Maternal mortality is still very high, unacceptably high for the world's richest country, 23 per 100,000 births. Most common cause of death are, again, the non-communicable disease, heart disease, diabetes, and road accidents. So again, they have a bad reputation for their road accidents. You can see it's quite a bit lower than Egypt at 23.7 deaths per 10,000 people. But they do have fabulous highways, I must admit. And 80% of the population in Qatar are expatriates, as we mentioned, in contrast to Egypt, which are primarily Egyptians. Qatar has a Supreme Council of Health, and by Emiri, so they have an Emir, who is the head of government, not a king or a sheikh. In 2005, he declared that there will be a National Health Authority, and this is the recommended infrastructure that World Health Organization recommends. The Qatar generally follows the British model for much of the types of government and law systems and health systems that they have. The main goal of the Supreme Council of Health is to establish premier quality health delivery system. The Medical Commission is responsible for giving a physical examination to every single person who comes into the country. You have an x-ray, you have a TB test, you have to be tested for HIV and hepatitis. And if you have any of these conditions, whoop, out you go. You're not allowed to come into the country. The Qatar's royalty, again, the Sheikh Tamim Hamad Al Thani, he is the crown prince who recently, last year, became the head of state, which is an emir. This is his mother. She's Sheikha Amoza. And this is his father, Sheikh Hamad. And he was the leader for the last 35 years. He has stepped down. He has been in good health, but he felt it was time for his son to take over leadership for Qatar. Sheikha, or Sheikh Amoza is her name. She's the emir's mother. She was a very strong advocate of improving education levels in Qatar, as is with the entire Middle East, because you have to remember it was only 30 years ago that they discovered oil in this region, and that since that time all of this development has happened. I mean, in half of my lifetime this whole country has been developed. And so these were people that were farmers, they were pearl divers, these are people who had agriculture, they had camels, they had little opportunity or time for education. They had no business savvy, and these are all things that they're very good at now. They have enormous banks, and the people, majority of the families are business people. They have their own businesses. Qatar Foundation is chaired by Her Highness Sheikh Moza, and it's devoted to a network of centers that will improve education and community welfare. The Qatar Foundation is partners with Shell Oil, Microsoft, and General Electric. So this GE is General Electric. They are currently building the Sidra Medical Center, and it's almost a $8 billion endowment to have this beautiful hospital. It's a smart hospital with all kinds of technology to support physicians and nurses as they're caring for patients, and it's primarily for women and children. When I lived in Qatar for 6 years, I was the Director of Public Health and within the Supreme Council of Health. And they are responsible for continuous epidemiologic surveillance for the country. These are my health workers. These are all people that are dedicated professionals for public health. And some of them are Qatari, so here is Maryam, and Khalid. These are all people that are nationals. Latifa. Whereas other people, these two women are physicians, and they are from Pakistan. So we have a mixture of national team as well as foreign physicians who support the public health department. Strengthening the health promotion through community education is one of the primary goals of public health, and implementation of diabetes and cancer prevention, health protection through immunization. So again, these are things that we do routinely in Colombia, the same in the United States, Canada, same with Qatar. They have preparedness in Qatar because of the strategic location of the country. They have a permanent emergency committee. They have a national avian influenza. I was there when we had the outbreak of the avian influenza, and it was one of the few places that actually reserved vaccine for the entire country, and they just sent them $3 million to reserve the vaccine specifically for their country. Animal Task Force, again, they have a sophisticated system that works well, but there are times when we don't want to see, hear, or speak about anything that is not working as it should. So we have Disaster Response Task Force, and again, the whole type of interaction between the Ministry of Interior, Ministry of Defense, with the task force that had to do with disaster response. And again, outbreak control and follow-up. We have routine national drills and exercises. So they're serious about really accomplishing what they need to for disaster preparedness. They have a national action plan to intensify disease surveillance in response to avian influenza or Ebola or whatever is coming. They ensure infrastructure and service support. So these are all things that are ongoing within Qatar and established, and they work closely with the UNDP, which is the development component, as well as World Health Organization, to make sure that they're doing things as they should by the guidelines. One example is for our emergency drill, and we're going to be finishing up this portion of the lecture right now, so I will be able to come back to that in just one moment.